This is the Florida Firefighter Safety and Health Collaborative hosting Dr. Kenny Fent and FACETS Eric Tade and retired Fire Chief Julie Downey for a quick overview of the National Firefighter Registry. Before we get started, I want to let everyone know that this meeting is being recorded and it will be shared publicly on YouTube. By staying in the meeting, you're giving your consent to be recorded and for your video, audio, and comments to be included in that final video. What say you? You say yes? Amazing. Let's go forward. So thanks for being here. Pretty much excited to introduce Dr. Kenny Fent and FACETS program directors from the state of Florida, Chief Julie Downey, and at the national level, Assistant Chief Eric Tade, who have been beating the drum of progress for the National Firefighter Registry of late and for some time now. And this is an opportunity for us to actually see more of what the National Firefighter Registry has in store. So as we admit people into the thing, again, I'm saying just please put your information in on the notes section, where you're from, what department, and what position you're with. We're going to start with a quick video from the National Firefighter Registry's website. You can get this video there, but it just gives an overview of the why we're doing what we're doing here. And let me see if I can get this started correctly.
I was diagnosed with stage 4 cancer of my thyroid. I learned later on that it was a result of keeping my Nomex hood, when I took it off, around my neck. All that suit and all that carcinogen was just laying there around my throat all day long.
The National Firefighter Registry is so critical because we need the data to get the support for the researchers and the support for funding.
We do not have a robust amount of women and people of color to be able to give us the data that we need. And it's very important to see the differences that we have when we're dealing with these chemicals.
Everyone is an exposure, and it's important for you to participate in this program so that we have post-fire scene data regarding exposures.
As we know, some cancers are pretty specific to females, and without this firefighter registry, we aren't going to be able to connect the dots when it comes to what female cancers are actually caused by firefighting.
We need to make a difference. We need to make a change. Now's the time to make that change. And we need you to help us with that.
When we start looking at the number of Latinos joining the NFR, then we're going to identify not only health issues, but we're also going to identify if there are specific types of cancers that are affecting them.
I think the National Firefighter Registry is important because for so long, firefighters have been asking, and what can we do about the cancers that we're facing? And I say by registering for the National Firefighter Registry, we're going to be pioneering a better future for those that come after us. This is going to be one of the largest efforts to date to understand cancer and how to reduce cancer. By registering, we have the opportunity to pave the way for new safety measures to protect firefighters in the future.
All right. Thank you. Awesome intro video. Thanks for suggesting that, Dr. Fent. It's my pleasure to introduce Dr. Kenny Fent from NIOSH. You couldn't ask for a better leader and someone that's been consistently and dedicated to the issue of firefighter cancer research and obviously prevention. And I'm really proud that you're obviously the lead on this National Firefighter Registry, and we're honored to have you today, sir. Thank you so much for taking a moment to present to us, and welcome, sir.
Thanks, Chief. I really appreciate this opportunity to talk about the National Firefighter Registry. Really appreciate all the momentum that we're seeing in Florida, and I'll talk more about that here shortly. But let me share my screen. Make sure we get this loaded up. So I just want to talk a little bit about the NFR for cancer and really why this is an important initiative for every firefighter in the United States. The National Firefighter Registry for Cancer came about through an act of legislation, the Firefighter Cancer Registry Act of 2018, with broad support from many fire service organizations, including IAFF, NVFC, iChiefs, and many others. And the NFR for Cancer is the only national registry of firefighters in the United States that really, makes it possible for us to, look at firefighters across the nation and understand their risk of cancer. And so the mission of the NFR is to generate detailed knowledge about cancer in the fire service through a voluntary registry that reflects our nation's diverse firefighters, and then to take that information that we get and give it back to the fire service and give it back to the public health and medical communities so that they have the information they need to actually reduce cancer in the fire service. So our ultimate goal is to reduce firefighters' risk of cancer, and to do so using the data that we collect. So I want to talk just briefly about how cancer monitoring and reporting happens right now in the United States. So, if you were to have a change in your health status that lasts for a couple weeks, then you absolutely should go see your personal physician. And if you go get a checkup, doctor might say, you know what, I want to go ahead and do some more testing. Maybe you're at the age where you're due for cancer screening. They might do some imaging, they might do some labs. And if there's something suspicious, they may want to take a biopsy, go ahead and send it out for pathology. God forbid, this could result in a cancer diagnosis. If you as a firefighter are diagnosed with cancer, or anybody in your state is diagnosed with cancer, it is reported to the state cancer registry. That's usually the state health department. But state cancer registries often do not collect information about your occupation. And it really depends on the state. Some states are better than others, but what it really comes down to is, did your doctor ask you about your occupation? Or did your oncologist ask you about your occupation? And did they document it in your medical record? And was that then shared with the state cancer registry? And so you can imagine that if you are retired, that your occupation may not be captured properly. If you're a volunteer firefighter, they might capture your primary occupation and not your volunteer service. And the bottom line is, regardless of whether a state is capturing your occupation or not, they are not collecting detailed information about your occupation. And what this causes is it makes it really hard for epidemiologists to study the relationship between occupation and cancer risk, specifically firefighting and cancer risk, if we don't have that occupational information. So this is why we need the NFR for cancer. This was the motivation behind the Cancer Registry Act, and why the fire service organizations advocated so strongly for this. We know there have been a number of consistent studies that have shown that firefighters have an increased risk of certain types of cancer, in particular bladder cancer and mesothelioma, colorectal cancer, and testicular cancer, and melanoma, and non-Hodgkin's lymphoma. Those are some of the cancers that we've seen consistent studies that have shown an increased risk for firefighters. But there are still a lot of questions that remain. We don't fully understand the cancer risk for volunteer firefighters, which in the United States make up about 65% of the fire service. We don't fully understand the cancer risk for wildland firefighters. We don't have a good understanding of the cancer risk for female firefighters or other demographic groups, because we haven't had big enough numbers of those different groups of firefighters that are part of those studies that have been done. And so, and then, like I said, the cancer registries, they may collect information about occupation, or they may not, but they're definitely not collecting detailed information. So we don't have information on how long somebody's been a firefighter, how many different responses have they been to, what kinds of fire responses did they go to, what kind of protective measures were in place. And so that's really the missing piece of the puzzle. We need to know more about your job, and that's what the NFR does. It provides an opportunity for firefighters to tell us about themselves and their work as a firefighter, so that if they ever are diagnosed with cancer, we have that missing puzzle piece to connect the occupational exposure to the cancer diagnoses. In terms of who can join, this is for every firefighter in the country, with or without cancer, active or retired, career, volunteer, structural, or wildland. And it's really important that we get some of the firefighters that have been underrepresented in research. So that would include females and wildland firefighters and volunteer firefighters, and even some of the subspecialties like fire investigators and fire instructors. The bottom line is we need to cast a really wide net, and we want all different types of firefighters all over the country to register, because it makes the data that much more powerful. Now, you might be asking, I don't have cancer. I hope I never get cancer. So why would I register for the NFR? And it's just as important that firefighters without cancer register, because we need to understand why some firefighters develop cancer and others do not. So, by registering, even if you don't have cancer, you're actually helping firefighters with cancer by doing that, because you're providing that data so that we can really start to do those internal comparisons and better understand what are the factors that are most associated with increasing cancer risk. The other side of this coin is that it's so much better to register now before you have cancer, because, and I hope nobody on this call ever gets cancer, but if you do, the last thing on your mind is going to be, let me go register with a government agency and tell them about my work as a firefighter when you're dealing with cancer. It's the last thing on your mind. And so that's why, another reason why it's important to register now. In terms of joining the NFR, we've tried to make this as straightforward as possible. It is a voluntary registry, but it's available to every firefighter. I mean, they just have to go to our web portal, nfr.cdc.gov. If you scan this QR code, it'll take you there right now. You'll confirm your eligibility, create your account, give your informed consent, and create your profile. Those first 3 steps can legitimately be done in 5 minutes. And once you complete those first 3 steps, you will get an NFR participant number, and you will be part of the registry. So when we say you can get started in 5 minutes, we mean you can get started in 5 minutes. Now, the enrollment questionnaire, which is really important because that's where we're capturing that detailed occupational information, that does take a bit longer. It can take 20 to 30 minutes, depends on how long you've been a firefighter. But the good news is you can log out and log back in at your leisure to complete that questionnaire, and you will get reminders to do so. So I can't underscore this enough. Your data are extremely valuable. So this is a promotional campaign we're doing right now. And it says, if you knew your story could help prevent cancer in the fire service, would you share it? And this is a true statement, because I know you may be thinking, I'm just one firefighter. How does my information help? But when your information, your unique story, and every firefighter is going to have a unique story about how long they've been a firefighter, how many responses they've been to, major events, disaster responses, you name it. When your story is combined with 30,000 plus other firefighters, that data becomes extremely powerful and helps us to identify those factors that are associated with increasing and even decreasing cancer risk. Because we're also interested in those protective practices that many departments have implemented over the last 5 to 10 years. In terms of how we're doing, this is a screenshot from our NFR data dashboard. This is publicly available You can scan that QR code at the top to get to this. But as of today, we have well over 30,000 participants. That makes the NFR the largest group of firefighters ever assembled in the United States to study their cancer risk. The largest study before this one was actually a NIOSH study called the 3-City Cancer Study from Philadelphia, FDNY, and San Francisco fire departments. That had just under 30,000 participants as part of that study. So within about 2.5, not even 2.5 years, we've already exceeded that in the NFR with over 30,000 participants. Our dashboard also provides participation counts by state, and you'll see that Florida is dark red. You'll also see that Arizona and Colorado are dark red. So these are the 3 states that are leading the country right now. Florida was in first place, but they got overtaken by Arizona within the last week or so. But it's neck and neck, and we love to see it. Spirited competition, and now it's a race to see who gets to 2,000 first. We have, I think, 11 or 12 states with over 1,000 participants, and I think it's very achievable that we could have within the next year 50 states with over 1,000 participants, and that would be huge. So check that out if you get a chance. And we are hoping to update the dashboard with new data visuals over time. So certainly check periodically back with the dashboard to see the latest that's posted there. We also have a Gold Helmet Department Recognition Initiative. So this is a way for us to recognize departments that have high participation rates in the NFR. So any department that is able to encourage participation among their active firefighters, and they get 50% or more of their firefighters to enroll, or for large departments, if they get more than 300 of their active firefighters to enroll, they will be recognized as a Gold Helmet department. And they will receive a web badge, a certificate, social media posts, and we'll highlight them also on our website and in our newsletter. As of today, this initiative hasn't even been going on for a year yet, but as of today, we have 53 fire departments in more than 25 states that have achieved Gold Helmet status. And before we started this call, I heard from Chief Eaton that it sounds like we're going to have maybe 2 or 3 more this week from Florida. So this is a great way, just again, for us to be able to recognize those high participation departments. I just want to talk real briefly about our collaborations. We're not working in a silo. Our goal is to try to work across the aisle with external researchers who are heavily involved in firefighter research. So we have a collaboration right now with the Firefighter Cancer Cohort Study that's being led by the University of Arizona and has a lot of other partners. We also have a collaboration with the Washington State Council of Firefighters and their personal injury, illness, and exposure reporting system, or PIERS, which is basically an exposure tracking application. And the way these collaborations are working is that these external researchers are getting permission from their participants to be able to share data with the NFR. And the participants can provide their NFR participant number, and that provides a confident way to link that data back to the NFR. And it just makes the information go further that they're already collecting, lessens the burden on the firefighter, because then we don't have to ask for it again. And this just provides a really robust data set where we can really look at exposures and how they relate to cancer outcomes over time. We are actively exploring a number of other collaboration opportunities, including with the University of Miami. Virginia has expressed interest. So we're hoping to kind of replicate this in other areas too. And again, the goal is to try to make the information that's already being collected go further Just want to say real quickly, because privacy and confidentiality always comes up, that the way we're doing this, we're always going to maintain your personal privacy. So your information is always going to be protected. We'll never share personally identifiable information, and all analyses are going to be on aggregated data. So we would never share your personal information with anybody outside the research team. So, the fire service is very data driven. So I think this will resonate with you. Data is powerful. If it's used the right way, data can be very powerful. The NFR is that initial data collection point. Our long-term goal is to enroll 200,000 firefighters. So we've got a long way to go to get there. But we've hit 30,000 in a few years. I actually think this is an achievable goal in the next 5 years. We want to try to obtain records where we can. Again, try to lessen the burden on the fire service by leveraging existing data sources and pulling those in and make sure that we can connect it to your profiles. We will be linking with state cancer registries over time. I don't know if that was clear, but once you register, if you're ever diagnosed with cancer, even 30 years down the road, we'll be able to pull in your cancer diagnosis and match it with your profile. And again, when we do that for everybody who's in the registry, we can learn a whole lot more about the risk of cancer in the fire service. And then ultimately, we want to be able to share what we're learning back with the fire service, back with the medical and public health communities, with an emphasis on cancer prevention. And so the next slide really hammers this point home. In terms of the potential impact, we believe that over time, the NFR has the potential to identify cancers that have not been previously associated with firefighting. And this is especially relevant for rare forms of cancer. So with rare types of cancer, you really need a very large population to be able to detect enough of those cancers to be able to draw conclusions about whether it's related to your firefighting occupation or not. And so that's, again, one of the reasons why we have that goal of 200,000 firefighters. And this could lead to increased medical surveillance for those types of cancers. We might also find that firefighters are diagnosed at younger ages for some types of cancer. We're already seeing this in the general population. We know that younger people are being diagnosed with colorectal cancer than ever before. If we see the same thing with firefighters for other types of cancer, that could lead to revised cancer screening guidelines. We might identify specific work factors that increase firefighters' risk of cancer, or factors associated with the reduced risk of cancer. And then that could provide evidence to support, revised policies, procedures, or even equipment. So the NFR, because it is voluntary, it's only going to be successful if we can get the word out to the broad fire service across the United States. And we would greatly appreciate your help with this. So we have a number of promotional materials that are free to download. If you scan this QR code, you can get to these materials that include videos and posters and fact sheets and just everything under the sun. And we continue to add to this every year. But you can also request professionally printed materials from us. So if you're interested in doing that, just reach out to us. And you can reach out to us at this email, nfregistry@cdc.gov. This is the QR code that will take you to our enrollment site. If you haven't registered, you could get started now, and before Chief Tade is done talking, you'll probably have your NFR participant number. But I'll stop there. Appreciate your attention. I know we'll do Q&A a little bit later. Thank you.
Awesome. Thank you so much, Dr. Fent. That was exceptional. And I obviously learned something every time. I appreciate your presentation. Let's hold off on questions until after Chief Tade presents. Go ahead. This is Assistant Chief Eric Tade. He's FACETS Director for the national program. He's the lead in this recent push to move the National Firefighter Registry forward and really get this information through ambassadors across the nation, right to the face of the firefighters. They're meeting directly with firefighters, large groups of them, and be able to answer questions just like we're doing today. Again, I appreciate you hanging with us. But before we move to Chief Tade, please go to the notes section and put your name, your department, your rank, or your organization in the notes for us. That would be helpful very much. Chief Tade, it's an honor to have you, sir. It's great to have you present for us.
Oh, thank you, Sam, and it's an honor to be here. I really appreciate the opportunity. I really want to discuss of how are we going to get firefighters to sign up. Dr. Fent did an amazing job of explaining, what the registry is, how we got the registry, because we had large fire service organizations come together and kind of ring the bell saying, hey, we've got a problem with cancer in the fire service. NIOSH has done an amazing job, as you just seen all the work they put into putting this resource available to us. But there's one last piece, and that's us, the fire service. We have to be involved. We have to be engaged. Luckily, Dr. Fent has given us the opportunity to really engage in a firefighter to firefighter outreach program, where we're sending out ambassadors, and Sam's one of those ambassadors. Julie's helping lead an amazing team in Florida. And that's what it comes down to is we rang the bell, but up until recently, we've somewhat failed to respond as a fire service. I mean, we should have seen people in droves. We should have hit 200,000 right away, because there is not a firefighter you talk to that says cancer is not a problem in the fire service. There's not a firefighter out there that isn't willing to risk their life to save another firefighter. And we're only asking them to take 2 to 5 minutes to sign up for a registry to potentially save hundreds of firefighters down the road, to maybe prevent firefighters in the future from getting cancer, and then making sure that we're doing everything we can to take care of our fellow brothers and sisters in the fire service that get cancer. So the question is, how do you do it? Well, what we do know in the fire service is we can't just send out an email and expect firefighters to sign up. And we always say we're a family. The fire service is a family. Well, when you're a family, if you had something that was important to you and you were looking out for your mother, your father, or your son, or your daughter, or your brother and sister, you wouldn't send an email. You wouldn't expect them to go find the material on their own. You would go and you would advocate to them and tell them how important this is. Well, the same thing is true in the fire service. We need people that are passionate about it, and we need that face-to-face contact, because we found the number one way to get a firefighter to sign up for the registry is to be there, be present. Dr. Fent shared that QR code. That's the number one thing we do. We have people out there carrying even just little business cards now in their wallets, and everybody they talk to, they pull out this QR code and say, hey, have you signed up for the registry? And unfortunately, a lot of people say, I don't even know what you're talking about. Give them that couple minute elevator pitch, tell them what the registry is, ask them to sign up, but then more importantly, ask them to take it and sign somebody else up. And really, let's take care of one another. And the way we do that is we have a team of ambassadors in multiple states. Anybody that's on here that would like to get some assistance in reaching out to their department or in their state for state organizations like state fire schools, some of the other fire service meetings like this one, let us know, and we will provide resources there to be able to do that outreach with you and do it together as a fire service. And really, it sounds like a lot of hand-holding, and that's because it is. If it's important to us, then we have to take and respond and say, we're going to take care of our family within the fire service. We're going to explain the importance to it. And then we have to educate ourselves too. That's the other piece. We can advocate like crazy, but take a little bit of time after this, go on to the NFR website and go through the frequently asked questions sections, because you're going to get those questions when you're out there advocating. I know there's a lot of people from Florida on this call right now that have been recently presented to from Sam and some of the other ambassadors we have down there, and they can all tell you, you're going to get those questions. People are going to say, well, why would I share my social security number? That's one of the biggest ones that comes up. Well, you might just remind them that they are just simply providing their social security number back to the very people who gave them their social security number. And the whole importance of that is that we want to make sure it's John Smith from Florida, not John Smith from Wyoming. And then some of the other data that's in there, people say, well, I don't want to share demographic information. Well, you can explain to them that that's very important, especially when we're looking at cancers. You know, are certain people more susceptible to some cancers than other cancers? And so most of those questions actually relate back to getting good data. Because at the end of the day, the research that comes out and the preventions that we are able to hopefully acquire through this data are only as good as the information people put in. And so our passionate plea is get out in front of your people, ask them to sign up now. If you're in a chief officer position and you have the ability to send out an assignment or send out an email to your troops, do that. It increases awareness, but understand that you're going to have to get in front of your people. And one of the things that we've seen has been one of the most effective things for a department to do on their own is almost everybody ends up having somebody that's on modified duty or light duty. That is an incredibly powerful modified duty position. We just watched Goodyear, Arizona. Within a matter of 2 weeks, they hit gold helmet status. They took a firefighter that was injured. They gave him a staff car. He drove around to every station. For the short time he was on modified duty, that station got gold helmet status very quickly. So it's employing strategies like that. And nobody knows how to talk to firefighters better than firefighters. And that's what most all of you are on this call. And that's my passionate plea to you is firefighter to firefighter, explain the registry, but don't just take the I'll sign up for it later answer. Have them sign up right there in front of you. Have them whip out their phones. Have them scan that QR code. So that's kind of my passionate plea to you. Julie, do you want to weigh in?
Well, I think you covered everything. And, I know in Florida, we have a great team of ambassadors that's going out there doing exactly what you said. You got to get firefighter to firefighter. We've already shown that just putting it as a Target Solutions or a Vector or any LMS you have and say, go sign up, doesn't really work unless somebody is standing there, overseeing that they're doing it and that it's being processed, but it's not, they don't do it. So I think that when you called hand holding is really important and, just sitting and having a cup of coffee and talking to them, the firefighters about the NFR, that's what's important. And that's what's making the difference. And having, like in Florida, a great team that's going out and getting to these departments. So really appreciate the team that we have and all the hard work and, NIOSH and FACETS for all making it happen. It's, we're on a trajectory and Arizona, you better step it up because we're chasing you.
That's awesome. That's amazing. Chief, fantastic call today. Obviously, I just want to capture the opportunity here for everybody that's on the call. We're going to run these again, possibly in October. And we definitely want you to bring your leadership back here. But today we have Florida, Colorado, Wyoming, Washington, Ohio, Pennsylvania, Missouri, California, New York, Texas, and Arizona on this call. Big round of applause for that. We also have organizations, our FACE team, NIOSH, FACETS, the State Fire Marshal's Office from Florida, and also from Pennsylvania, the State Fires for Arson and Explosives for Florida, Illinois Fire Institute, the First Responders Center for Excellence, the Sylvester Comprehensive Cancer Center at the University of Miami, Underwriter Laboratories, Fire Safety Research Institute. Gavin Horn was on momentarily, gave some good encouraging words and had to step off. And of course, the departments from all over the state of Florida. I'm looking at about maybe 15 different departments in Florida, and of course, those around the country. Arizona's on here. Mr. Orion Godfrey, you're gonna run out of stations, buddy. That guy can't, he can't go everywhere, right? So I'm just saying, congratulations to you. I'm glad you're on today. Congrats for making.
Bring it on, Sam.
Okay, whatever. Let's go.
Bring it on. We're in the driver's seat.
Oh, okay. No, we were shocked. We woke up in the morning on Monday. We're like, what happened? So we figured it was fake news. We weren't sure about all that, but it looks like it was legit. So congratulations, but we're not letting up. I'm just telling you, man, we're bringing it. It's going to happen.
And we're looking forward to it.
All right, Ryan, you're awesome, brother. Thanks for being on today, and I'm glad you're able to make it. Thank you, Chief Downey, for allowing me the opportunity to serve in this space with Chief Tade and FACETS, and obviously being part of this has been amazing as well. And I want to go ahead and open the floor in this last 10 minutes for any questions for Dr. Fent, Chief Downey, or Chief Tade.
Hey, Sam, Frank Lieb here.
Chief Lieb, how are you?
I am well. It's great to see so many people on this call, so many people moving in the right direction. Appreciate you bringing everybody together. So I just have a couple of quick things to just put out there, right? So my volunteer department on Long Island recently became one of the gold helmet departments. So Florida only has 2 of them, by the way. So
4. We have 4 now.
4. So with what I see in departments that are on those lists is that departments that have champions make the difference. Whether it's Billy Goldfeder and Otto Huber in Loveland, whether it is Mike Schneider in Lee Summit, or my captain in East Farmingdale, that's what you need. Champions that get it over the finish line. That's how you get the status. So the gauntlet has been dropped, Florida. Let's go.
Bring it, sir. Bring it.
And,
That's awesome.
And on a separate note, my department became a gold member, gold helmet department about a month ago. And I'm on the exercise bike. That's why I'm huffing and puffing a little bit. But we've had 3 members, 3 diagnosed with cancer since we became a gold helmet department. So what we're doing matters.
Yes,
and we should be at 200,000 already, and we're not. That is a failure, but we're going to get there with people like those on this call. That's all I got. Thanks, my brother.
Thank you so much for making me feel bad that I didn't get my workout in today. But Chief, thank you so much for jumping on. It's great to have you, sir.
Oh, yeah, sorry. I got sidetracked. I got waylaid coming down the hall earlier, so.
Chief Tucker, that's awesome to have you.
So good
Former
to see you.
Bureau Chief in the training division for Florida. Good to have
Good
you.
to see you, Sam. Thanks.
Any other questions for Dr. Fent, Chief Downey, Chief Tade?
So I was just gonna give some kudos to Frank Lieb too, because Chief Lieb helped us out with some videos. We could have showed his video at the beginning. Outstanding, you know, like words of encouragement for volunteer fire departments. So a lot of times, you know, volunteer firefighters think that this doesn't apply to them. It absolutely does. And he was able to, you know, being a champion within his volunteer department, was able to get very high participation among that department, well over 50%, upwards of 90%. So, you know, and I know with the gold helmet, we got to make a milestone. So the milestone's 50%, but we would love to get even higher than that. And so just really appreciate Frank and all he's doing out there in New York and else and around the country too. So just want to give him a shout out.
Awesome. Worthy.
Good afternoon. Paul Blake with a question for the doctor.
Go for it.
So in terms of the reporting of the registry, you mentioned that the registry does not specifically get the occupation, but does a registry at least cover gender, you know, maybe race, ethnicity? Does it at least cover that? Or is when we go to the station as we visit, is that you know, just specific to occupation? Like, does the registry cover everything else other than occupation? Thank you.
So I think there's 2 points that I want to make. So there's state cancer registries, and all 50 states have their own state cancer registry. If you're diagnosed with cancer, it gets reported to the state, and they will capture sex and other demographic information through those cancer registries, as well as the cancer diagnoses. But they're typically not capturing occupation. And in many cases, not collecting any occupation. And if they are, they're not collecting detailed occupation. So that's really what the NFR is doing, is collecting that detailed occupational information, as well as some other factors that could be, that could be associated with cancer risk too. So there's, questions about lifestyle and other health conditions you might have. So that's part of the questionnaire as well. Did that answer your question?
Yes, it does. Thank you.
You're welcome.
Sam, Dave Fischler for the doctor. Does a precancerous diagnosis where precancerous cells have been identified and the respective organ has been removed, is that a reportable event?
I don't think so. So through the state cancer registries, they're only getting diagnoses information. In terms of treatment information, that's part of your medical record, and that's not typically reported to a state cancer registry.
Thank you.
You're welcome.
Long-term for the NFR, projecting outward, do you see this information being maybe potentially supportive of federal grant money and things of that nature, an opportunity for fire departments to say, hey, look, for the last 3 years, we're clearly seeing this indication. We haven't moved anywhere, but now there might be some kind of federal assistance to fire departments to bring up the level of protection in their departments as it relates to cancer.
Yeah, I mean, that's part of that crystal ball that nobody can see perfectly into the future. But I would certainly think that, if we find evidence to support certain protective practices, like, routine laundering of turnout gear after a fire response, hood exchanges, gross decon, skin cleansing wipes. I mean, there's a number of protective practices that are in place today that weren't in place even 10 years ago or even 5 years ago. If we find evidence that suggests that that's actually helping to lower the cancer risk among firefighters, that's what we consider internal comparisons. I would think that provides a lot of ammunition, so to speak, for city governments to be able to support those initiatives more broadly and to fund those initiatives, or like you said, AFG grants to fund those initiatives. So I do think it's important. The fire service is very data driven, and this is some of the data that I think can help inform decisions in the future.
Great. Anybody else? We have an opportunity here with Dr. Fent and the FACETS directors to get some questions. So if you have anything at all, even though those of you that are ambassadors, certainly let's take this opportunity if we can. Any questions at all? And also from the research side, that's one thought in my mind. For instance, University of Miami is on here, Sylvester Comprehensive Cancer Center. This is a national study. Is there an opportunity for obviously collaboration with the information, the data? How would that look for somebody like those institutions?
Yeah, so we've stayed close, and we've always been working collaboratively with Dr. Fent, and so we have things in place. We have some MOUs, and so we've been in conversation of how we can take some of the data that you guys are well aware of that we've been collecting since 2015 and seeing how we can work together on sharing that information. We already have our registry linked in the state of Florida, but using that as a tool and kind of an example to other state registries and how we can assist that way. But yeah, all the work that we've been doing, all the work that NIOSH has been doing has always been in collaboration and complementary. And so that's something we always share, with any of our research projects when people ask. And I think that's important because there's researchers and scientists doing work all over the country to know that everyone is in support of NFR, and any work that you're doing for our research or for research in Arizona or anywhere across the country, it's complementary to NFR. So it's not that there's one or the other. Everyone is working toward the same goal.
That's great. That's great. And that's really one of the reasons, the invitation went out to Sylvester as well as Illinois Fire Institute. See Crystal Sweeney's on, and then Gavin Horn as well. I felt like there's this opportunity there, and it's good to hear that that's already that's already in place for sure. Sean Anastasia, retired battalion chief from Lake Mary Fire Rescue. Go ahead, sir, with your question.
Hey, thanks, Sam. Can you guys hear me?
Yes.
Yep.
Hey, so one of the things I've run into is people ask me about the survey, whether or not some of the information they put in tends to be a little bit more, they're guessing, right? How many fires they've been on over a certain amount of years. Is this like the version 1 of the survey? Is the intention to continually dial in that survey so the data becomes a bit more, I guess, progress like with this program? Do you understand what I'm asking?
Yeah. Yeah, I mean, that's definitely a limitation. If you're a more veteran firefighter, you're going to have to look back in time quite a bit and sort of guess on how many different types of responses you've been to and different departments you've worked for. So it's not a perfect survey instrument, and it would be impossible to develop a perfect one anyway. So that is the best we could do. We are working on a follow-on questionnaire that would be very short, that would be disseminated. It would still be voluntary, just like the initial enrollment questionnaire. And we would try to send that out every few years. And that would be more, more real time, like, hey, let us know over the last year or two how many responses, where recall bias would hopefully not be as big of a problem. And then, like I said, trying to really collaborate with those exposure tracking applications that are out there, because that is collected in real time. So if we can start to leverage and pull that information over to the NFR, that's really the best scenario, is to just pull in that data. But that's not going to work for everybody. So we would still do that follow-on questionnaire as well.
Just one comment here. I saw that Chief Kip Johnson, retired from Buffalo Township, is on here. He's volunteer department, as well as, I heard from Frank Lieb, and then of course David Fisher's on here. I wanted them to understand that this is for volunteers as well. So I did drop the link in the chat group, chat box there, and just if you have any questions at all, definitely 75% of our nation is covered by volunteers. They are absolutely part of this survey and this research project. Chief Bartow from San Antonio, Texas. How are you, sir? Go ahead.
Wow, I got a promotion. Thanks, Sam. Just a little lieutenant over here in San Antonio, Texas. I reached out to Dr. Fent a couple years ago. We had an annual cancer fair that we do here for the department, and his organization with the NFR was able to bring some people in last year, I believe. So thank you for that. I know we'd heard rumors that the NFR was not being funded anymore, and it stopped for a while, and I'm glad to hear that it's back. And I'm not too sure if that was just a rumor, if that happened. But I was asking, who do I reach out to see if we can get more support from the NFR for the cancer fair that we have every year now? And my second question, follow-up for that, for the gold helmet, how do I know, can we reach out to you guys to know what current numbers we have for our department to see how close we are to reaching that goal? Thank you.
Yeah, I'm going to put in a chat our email. So you can absolutely email us those questions, see if we can come out to your fair, your health fair again. And then also to provide, this is true for anybody on the call, to provide your enrollment numbers. So if you want us to check your department, we can do that. And we try to respond within the day, within 24 hours. So happy to answer that question for you, Dan, and anybody on the call. Don't hesitate to reach out to us at that email about anything. So did that answer your question?
Yes, you did. Thank you.
Yeah, great showing today. I know that we're going to have another one of these as successful as this was. We'll set it up. I'll work with my leadership, Chief Downey and Chief Tade, to get something set up probably in October for a second call. But and if we do that, I want everybody that's on the call here to be there. And I would love you to bring somebody with you, because this information is important, and that'll support the initiative moving forward as we move into the next couple of years with this. So any last questions for Dr. Fent, Chief Downey, Chief Tade?
And Chief Eaton, I'm happy to share the slides. So if you want to share the slides with everybody on the call, feel free to do so.
Okay, great. I'll get a link from you or afterwards. That'd be great.
Mm-hmm.
I'd just like to say thank you for everybody, coming on this call. Thank you for hosting it. And Dr. Fent, appreciate all the hard work. And, as Florida, we're going to be #1 probably in a week. So Arizona, step it up. But little competition is good. And just wanted to say thank you. Appreciate everything that you're doing, and all the ambassadors that are on the call. Thank you very much.
Awesome. Very good. Yeah, it's going to be a short-lived victory there, Mr. Orion. So just let me know. But it's all good. Hey, I love it. If you keep #1, maybe there's something even better than that for us. So, all right, take care, everybody. We'll let you know. We'll give a follow up on this. We did record this thing, so you'll be able to share it with everyone. We'll send that out, that YouTube link afterwards. And if you happen to not receive it, and you're not on a regular list of emails, shoot me a text message or shoot us an email, and we'll get that information to you as well. So thank you very much, Dr. Fent, Chief Downey, Chief Tade. Thank you for this opportunity, and we're looking forward to next month. Go out and get them. Let's go. Florida's going to 2,000. I don't know about you.
Awesome. Thanks, Sam. We
Thanks.
appreciate it.
Appreciate it.
Thanks, Chief.
Thanks for having us.
Take care.
See you, Sam.
Palm Beach Fire Rescue, National Firefighter Registry. Register today.